Welcome to the second episode of the Scorecards TV by My Aspirant, My Leader, your weekly show that focuses on the scorecards and election timelines of the elected leaders. Today's topic will be on matters health, and I quote, "The greatest wealth is health." Then locally, Abduba Dida has the solution, the preventive medicine. Eat when you feel the pangs of hunger.
Principle number 1, eat when you feel the pangs of hunger. Number 2, when you feel the pangs of hunger, don't fill your belly with food. You eat every githeri and then there is no space for water.
Let's now get global on matters of health with Elsie Birech.
Let's now look at the 5 facts of the state of global health. Japan continues to lead the world in life expectancy with an average lifespan of 83.7 years. Singapore and Switzerland follow with 83 years compared to the global average of 71.4 years. Life expectancy is lowest in Africa, reaching just over 50 years. Deaths due to cancer have become more common than those due to cardiovascular disease in high-income countries. Kenya ranks number 6 globally when it comes to research and development expenditure on health. Suicide was the second leading cause of death in 2015 in South Korea after road traffic injuries. And finally, much of Europe consumes more alcohol than the global average, with Hungary, the UK and Belgium among the countries where individuals consume nearly double the 6.4 liter average annually.
Machakos County, nicknamed Macha, is led by Governor Alfred Mutua. It has a population of 1.09 million people and 8 constituencies, namely Machakos Town, Mavoko, Masinga, Yatta, Kangundo, Kapiani, Matungulu, and Moyo. Currently, they have approximately 73 nurses, 19 doctors, and 35 clinical officers per 100,000 people. They are keen to automate 320 health facilities, set up a medical university, set up an advanced medical research lab at Machakos Level 5 Hospital, which also acts as the main referral hospital for Kitui, Makueni, and Kajiado County. Convert at least one dispensary in every sub-location to a community hospital to meet global standards of a hospital within every 5 kilometers.
Garissa is county number 7 and led by Governor Ali Buno Korane. Garissa County is one of the counties located in the arid and semi-arid regions of Kenya. Providing healthcare service delivery in such marginalized region has not been easy. However, since 2013, the county has witnessed great achievements in its health sector by reducing infant mortality by over 20%. The county governor is focused to develop Garissa County Level 5 into a regional referral hospital and a research center. We believe that the recently launched health sector monitoring the evaluation plan with the financial and technical aid from the USAID will support efficiency in the delivery of healthcare services.
Servant leadership for the people of Garissa, guided by the principles of democracy, equity, and inclusion.
The county government of Kiambu is led by Governor Ferdinand Waititu, popularly known as Baba Yao. Since inception in 2013, the county referral hospital has increased the inpatient capacity from 900 to over 1,700 by 2016. It has also reduced neonatal death rate from 12.7% to 8.3%. Constructed 2 ICUs in Thika Level 5 and Gatondo Level 4. The governor commissioned a fully equipped renal unit with 8 dialysis machines at Thika Level 5, procured 13 advanced life support ambulances, and digitized all health records through the Kiambu Health Information Management System. In the strategic plan, the new government's objective seeks to reduce the burden of diseases in the county, increase the public access to help and to contain the risk of non-communicable diseases.
We now turn our lenses to Kakamega County, led by Governor Wycliffe Oparanya. The county of Kakamega has witnessed a surge in maternal and infant mortality over the past decade. They have allocated in their budget 100 million shillings to address quality maternity services and postnatal care. The county hospital, the Kakamega Regional Referral Hospital, is integral to provision of specialized medical care in the region. In the current year, there are plans to do the following: have a modern ICU, acquire a state-of-the-art CT scanner, set up a renal unit in order to save lives and reduce referrals to other facilities, an upgrade of the 11 sub-county hospitals to fully provide X-ray services, theatre services, laboratory equipment, and rehabilitative services. In the long-term mission, the county government will launch a medical school in the region in collaboration with other partners including Masinde Muliro University. On July 2016, the county launched a 6 billion hospital for cancer and kidney failure. As my aspirant, my leader, we'll always track the progress of this county in real time.
County number 44, the border county of Migori, headed by His Excellency Governor Okoth Obado, is popularly known as Sirikal Matiyo. Since 2013, Migori County has made tremendous steps in achieving affordable healthcare. The county still grapples with insufficient health staff as the number of nurses, doctors, and clinical officers is still way below the national average. In July 2017, the governor opened 6 health facilities in Awendo and Rongo sub-counties to ease the healthcare situation at the main county referral hospital. The governor's long-term plans include reducing the distance from hospitals to home to 5 miles, construction, renovation, and expansion of healthcare facilities, among others. So far, he has spearheaded the upgrading of the Migori District Hospital to now the Migori County Referral Hospital and a medical training college. The constructions of modern theatres in Rongo and Awendo will be a major stride in his 13.4 billion strategic healthcare improvement plan commissioned in 2014 by the then County Director of Health.
Right now we're seeing people dying in places like Baringo for diseases like malaria at this stage. Do you think maybe as a country by now we should be somewhere, we should be able to deal with such kind of diseases?
We should be, but we have refused to. We broke the healthcare system when when the people started handling issues of, who do I want to lead this, who do I want to lead this, and therefore we broke the chain of public health, health promotion and things like that. So it's not a surprise that malaria is having a breakout, because then you find doctors or nurses there and then you chase them away because you want to employ your cousin who is a lab person or who you hear has been a doctor, but probably this person is a quack. So those are things that are going on. The governors have said before that they find veterinary people in hospitals treating human beings, and they claim they are doctors, but they are not doctors because they are not on any register. No medical school can claim to have taught them. And even the many people that hangaisha wananchi out there, some of them are not doctors. So these are all things that are there. But I think also to say that the governors or elected leaders, the reason why they will be voted out is because of health. And let me be very specific to governors. And this is actually not a joke. 20 governors went home. The reason why those 20 governors went home was because of health. So any governor who wants to be elected, and I'm very happy that some of them, like Nandi governor, have already taken the cue. Any governor that is looking at a re-election must look at health.
Can you point out maybe specific counties that, from your own opinion, maybe are doing better?
When it comes to health in the whole country, we are only doing badly. But then there are governors that we can say are having initiatives. And one of those governors in the first phase of devolution has been Governor Ngwea. In terms of addressing the doctor-patient ratio, he's been employing doctors. Kakamega, yes, they have also been very progressive. It's the only county in the previous devolution phase that didn't face a health worker strike, except for those that were national. So there are those counties. Kiambu, actually, Kabogo did very well, but in terms of infrastructure, and he did real things in terms of trying to improve the status of hospitals. The only thing that he didn't do well was the treatment of health workers. But overall, I can still give him 4 out of 6. And because he didn't treat health workers right, he went home anyway. So all the governors the only governor that I can say survived, and we don't understand how, but he also mistreated Parajamo. All the other governors that mistreated health workers or mistreated healthcare went home. All of them. Yeah. Okay. Yeah. Starting with and it's true, if you look at the pattern of all the governors that were voted out, it was purely health. So it's a very serious issue. So these governors that have come in, especially the 20 of them that are new, you want to be elected, look at health. It's because people, you see, it's something that people connect with. Yeah. You connect with the fact that I took my uncle to hospital and the hospital saved him. You connect with that instantly. Yeah. And the other thing that I can say about to the governors is that health is not just about buildings. Health is not just about equipment. Health is not about launching drugs. Health is a whole system. Yes. And this system starts with how much money you allocate to it. It starts with the leadership, your own leadership. Yes. And when the governor of Nandi, Governor Sang, says that himself he will go to the public hospital, that's a good thing, because then you want the quality to be one that even yourself you like. So leadership, health needs workers, and those workers must be in good numbers. Yes. In places like Siaya County, the number of MCAs is more than the number of doctors, for example. So it is true. Yeah. In many places, Yeah. So if you look at health, is a whole system. So you look at the workers, look at the leadership, look at the money you're putting in, look at the systems of the supply.
Today's hotspots are brought to you by Kenya Online, a business portal that profiles businesses and experts, and the focus is on health status.
This is one of the counties with the least number of doctors population ratio at 1 doctor for every 200,000 people. The Elgeyo Marakwet County made a resolve later in September to fire the striking nurses following the 3-month-long stand. The county boss said in a statement that it has been established that the situation is bad and the status of the health sector has worsened due to the nurses' failure to report to work. We, however, note that in their bid to fire nurses and hire fresh students from college, the county runs into a risk of messing up the operations by giving a chance to the inexperienced new lot. Reporting for My Aspirant TV, I am Ivy, and this is a hotspot.
Kajiado County doctor population ratio stands at 1 doctor for every 26,000 people. The distribution of health facilities is uneven, as most are located within the urban centers. The current regime is focused on construction of health facilities in the rural areas to be a priority. In its strategic plan, the county government is aiming to provide essential health services by ensuring services are affordable, equitable, accessible, and responsive to the residents of Kajiado County. The current scenario is untenable and calls for urgent measures to provide the support needed. Reporting for My Aspirant TV, this is a hotspot.
This is Siaya County. Prior to the signing the back to work agreement last Thursday, the county boss Cornel Rasanga's administration already fired 512 striking nurses. According to the latest government statistics, Siaya County is listed as the worst in terms of providing healthcare services, with the doctor population ratio at 1 doctor per 100,000 patients. The nurses are also adamant and stuck to their grounds that the government must honor the collective bargaining agreement signed with the Council of Governors in March earlier this year. This situation puts hundreds of patients at risk. For My Aspirant My TV, my name is Nelson Black Maritini, and this is a hotspot.
Over the recent years, Nandi County has suffered an acute shortage of health workers within its public health facilities. Reports indicate that the former Governor Cleopas Lagat never invested in human resource providing health services. As a matter of fact, over his entire tenure, the county boss never advertised for any vacancy in the sector despite growing need for health workers. With the doctor population ratio being at its lowest in the county, the question that begs and the question that we ask is whether the county government is serious in investing on health matters. For My Aspirant My Leader TV, this is Schofield, and this is a hotspot.
We will always keep you informed on what your county governor is doing. Did you miss on your county? No worries. You can visit our website on www.myaspirantmyleader.co.ke and download our mobile app for all counties and their performances on matters of health in real time.